Guys, as you know, this is deadline day for Obamacare. Today is the day that Americans will have to sign up if you want coverage to begin on January 1st. Now, Democrat Senator Joe Manchin of West Virginia, who was actually previously pushed for a deadline, delay in a deadline, said yesterday that we should have a transitional year. This is what we need for Obamacare to work. Take a listen.
If it's so much more expensive than what we anticipated, and if the coverage is not as good as what we've had, you've got a complete meltdown at that time. So this transitional year gives you a chance to adjust the products to the market and to see if the market will absorb and buy the product.
To Congressman Kevin Brady from Texas, who joins us now. Congressman, what I saw was a Democrat who is extraordinarily afraid of what's going to happen to his party come the midterm elections. And then the image that I saw over the weekend was a president watching a basketball game who didn't have a care in the world. Which one is right?
Well, Senator Manchin is, and all of this was predicted several years ago on the passage of this bill. The coverage gap is real. The thought that Americans who've been forced out, since in my district, forced out of the health care plan that they want and like and unable to get coverage New Year's Day, not sure if they can go to that hospital or to that life-saving medicine that they need. And so right now, I think because the poor enrollment at the beginning, the White House has to be enrolling 100,000 Americans each and every day of December to prevent that coverage gap. Obviously, I think they're probably covering maybe 1/10 of it.
Congressman Brady, there's no doubt about that. Now, here's the thing. When the bots initially happened, the White House blamed governors in red states. They blamed, I think maybe one or two blamed Bush. Where does the GOP find itself with respect to this? I know it was completely partisan, but does the GOP risk anything by not trying to help out this fiasco?
Actually, I think we have been helpful from the standpoint early on. We said, look, this needs to be optional. For those who want to go into the new health care law, fine. But don't force anyone. Make this completely voluntary. This past summer, we passed legislation in the Senate, to do exactly that. 20 Democrats at the time joined with us saying this ought to be optional if you want to put people first. And it's sitting there in the Senate. My guess is if we vote on it again, we'd get double that number of Democrats joining us. So the solution's sitting in the Senate if they're ready to take it up.
All right, Congressman Liz McDonald here, switching gears just slightly. You know, we had the Target breach of 40 million credit and debit card accounts hacked. Now JP Morgan's saying, you know what, we're going to restrict your debit cards if you used it in a Target store. But, you know, watchdog.org is already reporting that the government healthcare website, health reform website, that it does not have to disclose if those consumers have been hacked into, only if they're state-run exchanges. In other words, the federal government doesn't have to disclose if a consumer is shopping on that healthcare.gov website and have their personal identifiable information hacked into. Is there a fix here? Why is there such a disconnect between the government being exempt here with its website and not private sector companies?
Well, despite the White House calling this a marketplace of health care, it's anything but that. And the fact that they could exempt themselves from those types of privacy notifications that every American takes seriously, in fact, expects and demands from their own private companies that we do business with, like credit cards. Clearly, this could be an area of common ground between Republicans and Democrats, because we've all, unfortunately, lost our credit cards have been stolen, the identity of them and used. It's too common in America, and the thought that 1/6 of the economy would be exposed, but without any recourse and notification of consumers, that's awfully troubling.
Hey, Congressman, the president just made another adjustment to Obamacare on his own, unilaterally allowing some of the people who lost insurance to get low-cost catastrophic insurance. That's a concern to a lot of insurance companies, by the way, who think that maybe that'll bust them. But how much longer are you guys in Congress going to allow the president to diddle around with a law that was sanctified by Congress, something that the Constitution doesn't allow? Have you ceded that authority to the president?
No, absolutely not. And the House has acted time and time again. Unfortunately, the president's got a blocker in the majority leader, Harry Reid of the Senate. He's been able to prevent any legislation from coming to a vote that would actually enforce the law the way it was passed and signed. And unfortunately, as long as they take that approach, the president's going to be able to do this What he is doing, though, is he is accepting Republican solutions bite by bite by bite
Right.
to try to avoid the political consequences of a terribly written law. I don't think it can hold.
You know, that whole irony of it all, ego and ideology pushed the president into a bad decision, and now the same thing is stopping him from making even another bad decision. Before I let you go, a lot of people are saying 2014 feels good already out the gate, and the only thing that can mess this thing up is a debt ceiling fiasco in Washington, D.C. Is your party going to be united on this? Will you just go ahead and pass a higher debt ceiling, or will you draw a line in the sand that can take the focus off of Obamacare? There are a lot of people in your party that want you to fight.
Yeah, I don't think it has to be that stark a choice, frankly. Republicans are not going to increase the debt limit without some effort, some real, authentic, genuine cuts or reductions in spending going forward. But we're also cognizant that the biggest budget bust we've got is the Affordable Care Act. We want to keep the curtain drawn back so the American public can see the impact of this law on their lives and on doctors and our hospitals and eventually our budget. And so obviously we'll do nothing to distract from this new law.
Congressman Brady, have a great Christmas. Thanks for spending time with us.
Thank
We'll talk to you
you.
again real soon. Right now, though, I want to get back to Nicole.